Música.
Kia ora, and welcome to the 2009 New Zealand AIDS Foundation Annual Report. The NZAF is New Zealand's leading community-based HIV prevention and professional support organisation, and each year produces an annual report detailing its progress and publishing its financial details. Building on the success of last year's DVD, the report has again been produced in this format. Along with interviews from key people from the foundation, you'll also get to see a number of the events that NZAF is involved in and hear about the challenges, successes, and future goals. The New Zealand AIDS Foundation has a vision of a world without AIDS and aims to achieve this by preventing the transmission of HIV and supporting people affected by HIV and AIDS to maximise their health and well-being.
So I met Bryce in 1984, and he was raised in an era where homosexuality wasn't legal and was discriminated against. Bryce didn't actually have the acceptance of who he was until much later, once he was positive.
He'd deny it till he was blue in the face, whenever Mum would confront him.
We're now quite a few years down the track. Bryce died in 94.
Definitely it wasn't until after he was diagnosed positive that he came to terms with accepting who he was, with being able to get that support.
These days I know there's a lot more education and support and resources available to families that have a family member that's positive. So it's good to be this far down the track, knowing that there's a lot of work going into the support services.
Ensuring the community's health is essential in stemming the spread of the HIV epidemic. I'm joined here now by the Director of Positive Health, Eamon Smythe, and Regional Manager for the Burnett Centre, Wayne Otter. Can you tell me about the staff at Positive Health?
Yeah, all the staff of Positive Health come from, very diverse backgrounds, all genders, all identities. They belong to different therapeutic groups such as New Zealand Association of Counsellors or New Zealand Association of Psychotherapists. We also have volunteer placement counsellors, which are normally people that are working towards their degrees, so they're more than likely in their second, possibly third year of training. They come under the guidance of the more senior staff around the countryside, and we've also got contractors based in most rural centres around the country. Well, probably not most, but we're hoping to get there within the next 12 months, but we've got them based in Napier, New Plymouth, Dunedin, the West Coast, Invercargill, to name but a few. So that's just to make our services more accessible.
3 years ago, the NZAF introduced fast screening tests. This was very successful. Have there been any new developments since then?
Yes. In the last 12 months, we rolled out the rapid syphilis test to augment the HIV testing. It's along the same model, which is a single finger prick test, and you get your results back in 10 minutes. Combined this year, we've done over 2,500 tests. When you look at 3 years ago, we were only doing 250 tests. That's a huge move forward.
Absolutely.
And we've also introduced here in Auckland a sexual health screening, which means that people can come along, have the HIV syphilis screening, then go pop in straight and see the sexual health nurse and have a full sexual health screening. We're also looking at doing that with a venue in Christchurch, and soon to be open a sexual health service, Awhina in Wellington.
Eamon, not all services are subsidised, so how do people living with HIV access the services that the Wellness Fund provides?
Yeah, the Wellness Fund was relaunched in April of 2008 to be more specifically around health needs. It's been very well accessed in the last year, with a number of significant health needs being addressed: major dental work, Aquamed, which is a filler for facial lipoatrophy, which is one of the long-term side effects of antiretroviral medications, plus a range of other health services such as GP, podiatrist, optician, anything that's health-related. The fund itself, of course, is funded through the generosity of people making donations to the New Zealand AIDS Foundation, specifically for the Wellness Fund. as well as being a large recipient of money from the World AIDS Day collections.
How can somebody find out about those positive health services?
Well, firstly, they by word of mouth, or secondly, they can find out through our new brochure that was funded by the Queen of the Whole Universe, or naturally go to www.nzaf.org.nz, our new website.
So positive health services are growing. What are the plans for the future?
Yeah, what we did was we did a survey together with La Trobe University, HIV Futures 2. That gave us some really good statistical information. Then in the last year we did another survey that was just for positive people in New Zealand, which is more of a local level, so it wasn't nearly as involved. But the results of that survey were very much in line with HIV Futures 2, which gave us some good ideas of where to go to from here. Overall, we're planning to increase the services that we offer through a range of new STI tests, increase the services that our counsellors offer, increase the availability of services. We're looking at employing a paediatric social worker in the near future, a clinical nurse specialist in the near future, and by the time we've done this, it'll be time to do another survey and see where to from here.
Has there been a lot of interest in these developments?
Yes, there's been quite a lot of international interest. Dr. Helen Lee from the University of Cambridge was in New Zealand recently, came to our services, had a look around and was so impressed that she invited me to go and speak to the faculty, which I then did, spoke at Addenbrooke's Hospital, managed to speak to some people from the Centre for Disease Control and Doctors Without Borders as well, all of whom were very impressed with the work we're doing over here.